My name is Scott Blumenthal, and I'm a spine surgeon at Texas Back Institute and the co-founder for the Center for Disc Replacement. I'm an assistant clinical professor at UT Southwestern Orthopedic Surgery Department and deputy editor of the European Spine Journal. I'm really happy and in fact honored to be asked to participate in the National Spine Health Foundation. I've done some similar work with artificial disc advocacy groups, and I've found this to be very rewarding. I'm really looking forward to it. My most favorite part of my job is Monday morning. I enjoy going to work. I enjoy seeing what spine problems come to see me and the ones that we can help surgically and the ones that we can, in fact, say, maybe that's not the best path for you. Because in fact, 90% of the patients we see are non-surgical. So an honest opinion is really what people want. And probably the most rewarding thing of what I do is that I love giving an honest opinion and not recommending surgery if there's not a real goal to be had. When I first started in practice, when people had debilitating back and neck disc issues, we were doing a lot of fusions. And patients asked, well, why don't you just replace the disc like they do in hip and knee surgery? And frankly, for the last 20 years, that's been the focus of my practice. We started the original FDA studies now over 20 years ago and founded the Center for Disc Replacement after a few of these discs became FDA approved. And now, interestingly enough, we've kept a registry from patient number one and have probably 3,000 or more patients already enrolled in this registry. In fact, we have a registry that's larger than some countries. So to answer your question, artificial disc surgery, both in the cervical neck and lumbar low back, has been the passion for the last 2 decades. The really rewarding part about treating these patients with this new technology is that in the lumbar spine, we've raised the bar over the old fusions that we used to do that were not 100% successful, had a reasonably good success rate, but now with disc replacement surgery, perhaps raise the bar, 10, 15%. In the cervical spine, we've actually created a standard of care now that disc replacement in the cervical spine has really supplanted fusion for most degenerative disc conditions.